Everyone, Dr. Kerry Yerke here, and welcome to True North Practice Management and our webinar today on social media for health professionals. Sorry for the technical glitches getting started, but today we want to go over why social media is important for health professionals and what you can do to boost your social media profile in 2021. So today's webinar, Social Media Strategy for Health Professionals. I'm Dr. Kerry Yerke, the founder of True North Practice Management. I started True North over a year ago to help health professionals start their practice, to manage their practice, and have a better career. And I did this after 25 years of my own practice, wanted to give back and to help other professionals. So what is your social media plan for 2021? It could be to increase awareness about your service. It could be to help people in your community with the type of care that you provide. It could be to increase your business by increasing your new clients and the referrals that you're getting in the practice. So there's a number of different reasons why people want to increase their social media profile. What you can do is you can increase your awareness by posting quality posts about what you do. So posts that have some images, a video, good copy or good copywriting that go with the posts, and posts that share your vision and your mission, posts that share what you're doing in your clinic, posts that include your patients when they do give you consent to do that in the form of a testimonial or a review. They're all very important in increasing the awareness about your service in the community. I like to post frequently. I know there's some debate over this, but when you post frequently, you give people an opportunity to see your posts. So your followers, if they like your content, they're going to enjoy seeing your posts. And then people that are scrolling through at that time, if you're posting frequently, they're going to see your posts so that you give them a chance to start to follow you. You should be detailed about what you do, so make sure you include details about your service. People are curious and they want to know how the procedures work, what the benefits are. You want to talk openly with them like they're a patient of yours, like an average type of patient of yours. You want to have a call to action, and those call to actions should be frequent, but not on every post, where people can book an appointment with you, or they can go to your bio and they can actually book an appointment through your bio. And every platform's a little different, like Instagram's different from Facebook, and that's different from Twitter or LinkedIn. Personal content should be included, but should only be about 20%. So people do like seeing videos of you and what your hobbies are, what you're doing outside the clinic, and what your interests are. So I would include personal content in your feed, but keep it to about 20%, because really what you're selling is your service and your expertise. And so I would keep most of the content focused on that. The content should be primarily video with some pictures, and then the text accompanying the video and the pictures. So the text should describe the video or the photo. You should include descriptors as far as where you're located, who you are. Keep it fairly basic in most of the posts, as if a new person is interested in who you are and where your clinic is located. Add a variety of different formats and use different apps to produce your posts. So I'm on Canva right now doing the slideshow, and Canva is excellent, but you can use Vimeo or Magisto or other types of iMovie to produce your video and your posts. And then add links. Make sure you add links to your scheduling page, links to your clinic website, links to your bio. So add a variety of different links to your posts so that people can click on those links and go to where you'd like them to go. Hashtags are important, primarily for Instagram, but for Instagram, you want to make sure your location is turned on. And Instagram now uses a Facebook page. So when you're posting, it'll use your Facebook location quite often, or your location of where you're posting from. So it's important that you're in your target area, that you have hashtags for your target area. And then you also have hashtags for your target audience. And I would use a hashtag generator for that. Mix it up and use tools like social media analyzers to see what's working. They'll list your top posts, they'll list the top hashtags, and so you can keep an eye on that, and then that'll make your social media more effective. If you want to increase your business, provide a link so people can schedule appointments online. And some of the platforms like Facebook allows a scheduling right online. Of course, you want an integration with your software, so you want to make sure everything's linked up so you're not missing anything. You want to provide a call to action button like call your office to book an appointment. You want links to buy your products and services if that's possible for your type of healthcare service or business. And then you want to make sure people know more about the type of platforms you're on. So let them know you're on Facebook and Instagram and Twitter and LinkedIn, wherever you want them to go and wherever your target audience is. And I would say for most people, they're on Instagram and Facebook. But Pinterest and TikTok are becoming more popular now too. So Instagram and Facebook for health professionals, that's primarily where you want to post. You can repost onto Instagram and sometimes repost with Facebook too. So once you have some good content, you can often repost or modify the posts and repost. LinkedIn is good for peer-to-peer, so from a professional to professional, and it may lead to referrals for you, depending on the type of health professional that you are. TikTok's kind of fun, and it's new. So there's a lot of people that are able to use TikTok, and some health professionals are doing a very good job on TikTok right now, getting the word out. And Pinterest. Pinterest is becoming more and more popular as well, and just posting images and pictures of your clinic, pictures of your patients, pictures of what you're doing, can be very good on Pinterest as well. The services we offer at True North are webinars, mastermind groups, and mentorship. So for 2021, we have a very simple format with free and paid webinars. We have mastermind groups that meet on a monthly basis, and mentorship, one-on-one mentorship with health professionals and their team. Our strengths at True North are working with students that are transitioning into practice, so startups, growth strategies, so clinics and professionals that want to grow quickly. We can help to shorten that learning curve and to help you get there a little quicker. Efficiencies, making sure the steps in the clinic are efficient and you're not wasting time or have extra steps that are not productive in your clinic. Hiring professionals and staff. We have quite a bit of experience searching and hiring professionals and administrative staff to help you to accomplish your goals. We've helped clinics and professionals with their finances to have good positive cash flow and to use their cash flow wisely, whether we refer to an investment person or steer you in the right direction as far as purchasing a building or purchasing a home or opening another location. These are some of the things that we've talked to our clients about. Building and design. We have experience with actually building, construction, and the design of clinics. The doctor-patient communication, so how you communicate with patients, how you can encourage referrals, how you can have a clear care plan and reassessments for patients. You're an expert at what you do. It's more the structure of how you're following up with patients that is important. And then, of course, social media marketing, what we're talking about today to help you with your content. Right now, we're offering 50% off until the end of the year. So until December 31st, if you want to book an initial consultation, they are 45 minutes in length, and we charge $267 US for the 45-minute consultation. Right now, it's 50% off. And then we follow up with our clients weekly or bi-weekly, depending on what they need. And we reassess after a 13-week period if they're weekly. Depending on the pace of growth with bi-weekly, sometimes we'll reassess at 13 weeks and sometimes at 26 weeks at 6 months, and just see how the client's progressing and set goals for the next time frame. We like to work in 13-week or 26-week blocks of time and then reassess. We will help you with your vision and mission. We will help you with the action steps to follow through on that vision and mission, to set goals. We will hold you accountable to those goals and to those action steps, and then provide feedback for you on how you can get there or what the different options are for you to succeed. We do have an advanced webinar on this topic. It's coming up in January on the 16th and 17th. So if you want to improve your reach and your conversions as a health professional with social media, we're going to do a 1-hour webinar that will dive into the advanced strategies that we talked about today. So improving your graphics, we'll talk about how you can do that and show you some examples, how you can write better sales copy, find the best hashtags, and get more conversions that will become new clients and patients in your clinic. There's early bird sign up for this right now for the next week. So you can go on to Eventbrite or Facebook Live. You can go on this page. So follow us on this page, and then you'll see in the event section the upcoming webinar on the 16th and 17th. And it's $91 US for the event, whether it's the Saturday or the Sunday. One event's on Eventbrite, the other one's on Facebook Live. But there's early bird sign up right now, and there's a good discount for doing that in the next 7 days. So go on to the event and you can sign up for that. If you guys have any questions, you can definitely message me. I'd be happy to respond to your questions. And our contact info is our website's TrueNorthPracticeManagementInc.com. You can follow us on Instagram and Twitter at TrueNorthPM. On Facebook, we're at True North Practice Management. And on LinkedIn, we have a page called True North Practice Management Inc. So we hope to see you over there on those social media channels. And we hope to see you at the next webinar, which is a paid webinar in January. And then follow our events. Make sure you subscribe to our channels, because we'll have more free webinars that'll touch on subjects like this, like we had today, and some of the strengths that we play to with our clients. And then we'll have some paid webinars, mastermind groups, and coaching throughout 2021. So thank you for joining us today, and we look forward to seeing you next time, or talking to you one-on-one by the end of the year.